Well, good afternoon, everybody. I hope you are able to
Good
hear me.
afternoon, sir. Good afternoon,
Good
sir.
afternoon, follow me. Good afternoon. Am I audible?
Yes, sir, you are audible.
Okay, good afternoon. Well, friends, today we are going to have a very important webinar on an important topic of the conceptual framing in the efficient management of the supply chain in a hospital. And we have a very distinguished speaker. He's Colonel Ashish Banerjee, and I'll take the opportunity to introduce Colonel Banerjee a bit later after I speak a few words about the Astron Institute of International Studies. And we will also introduce you to Dr. Neeru Bhatia very soon, who is the Executive Director. And as you may be aware, you see the Astron Institute of International Studies has been recently accredited by the NABET. Accreditation by the NABET is the, like we have the NABH, one of the board for hospital accreditation. Similarly, for accrediting the training programs and training institutions, we have the NABET, which is the National Accreditation Board for Education and Training. And we have also launched a number of, and this accreditation for the online courses, but we have the Astron e-college also. The Astron e-college is, and the courses, the various courses which are developed are of about 2 to 3 hour duration. And the courses different topics, but mainly they are the health and hospital related topics. And on completion of these e-college courses, you will be getting a globally recognized certificate with the lifetime validity actually. So this e-college has already become very popular, and the details you can also get about the e-college from the Astron website, which is the www.astronecollege.com. Now let me take this opportunity to welcome Colonel Ashish Banerjee. I will request Colonel Ashish Banerjee to please switch on his video. Colonel Ashish Banerjee. Yes, hello, good afternoon, Colonel Ashish Banerjee. How are you?
I'm good, sir. Thank you, sir.
Oh, great. Welcome, most welcome. And we are very happy to, have you today for this important webinar. And Ashish Banerjee is the medical graduate. He has done his MBBS. In addition to that, it's very interesting to note that very few people go into the legal matters and legal aspects. So he has done his LLB, and he's also a PG DHHM, which was developed by me only in Indira Gandhi National Open University. Yes. So let me also say that Dr. Ashish Banerjee is holding another diploma, that the PG diploma in medical legal services as well as the diploma in forensic law. And his current designation is he's the Colonel AFMS, Armed Forces Medical Services Legal, in the office of the DG AFMS. The current work areas of Colonel Banerjee are very interesting. Now he's looks like from his brief profile that we have got that he's more of a legal expert these days. So he's working as giving the legal advice to the DG AFMS and the Ministry of Defense on legal and procurement of medical items. He's also defending Government of India in HR issues, that is the administrative law and medical negligence related matters at the various forums, which is which are AFTs, the NCDRC, and then the High Courts and Supreme Court, also representing Government of India in arbitration and the post-contract legal issue in the Central Administrative Tribunal, CAT, for the various service matters. And also is directing staff, DS, at the officer. He was the directing staff at the OTC, Officers Training College, Lucknow. And Dr. Banerjee is also the honorary faculty and guest faculty to many organizations and institutions on various issues, especially legal aspects as well as the supply chain management. And he's also done a few publications which are to his credit, which have been published in Charak, the Indian Journal of Military Medicine, and special, it was a special COVID edition, and he published about protecting the healthcare workers against COVID-19 and the legal aspects of the same. Then he has also published Challenges and Opportunities in Social Media for Healthcare Delivery by Armed Forces Medical Services, and then also a paper on comprehensive study on corporate and business law in India. That's in the Symbiosis Journal. And then most important, I must congratulate you, Kal Banerjee, for the Chief of Army Staff Commendation in 2016 for his distinguished services to the armed forces. So you can see that he's very well decorated and important person in the DGFMS. So with this introduction and about myself, let me also tell you that my name is Dr. Ashok Agarwal, as you can see it also. And I'm a medical graduate from Armed Forces Medical Services. And then, of course, have been working in various positions in Government of India, that is in Safdarjung Hospital, as the Assistant Medical Superintendent. I was the former Director and Professor of the School of Health Sciences, Indira Gandhi National Open University, popularly known as IGNOU. And then I've also worked as the Dean Academics at the IIHMR in Delhi. And currently I am the Adjunct Professor at the IIHMR, and I'm also working as the advisor to the Astron Institute of International Studies. With this little profile and background, let me welcome Kal Ashish Banerjee, and the floor is yours, Kal Ashish. We have, you can see, we have the large number of students who are very keen to listen to you, and also some of the faculty members of Astron who are also very keen to listen to you. So over to you, Kal Banerjee.
Thank you so much, sir, for your very kind words. I'm absolutely indebted for the introduction. So with this, allow me to share the screen.
Yes, please.
Sir, with your permission, may I start?
Please start. We can see your screen.
So thank you so much, sir. Am I audible also?
Oh, yes, very clearly.
Astro
Yes.
Thank you so much. Today we are having a curtain raiser on the topic that is displayed in the viewfoil, that is conceptual framing in efficient supply chain management in hospitals. Now, the problem of supply chain management in India is still, it's quite an unregulated or semi-regulated structure in which a lot of work has been done and an independent access which are not interrelated. Also, the fact that as it stands today, it stands today is that of the active ingredients, active pharma ingredients, that is API, that we are harvesting or bringing from China. The problem is that if you don't have a robust supply chain management in Indian healthcare setup, and the erstwhile concept is the more the better, have an inventory as big as it can be, would not really suffice if the supply at the beginning is kind of curtailed or it is stopped because of some border skirmishes or conflicts. Notwithstanding that, there are various modalities of inventory management which would be rendered kind of more expensive, and obviously cost cutting being the basic norm nowadays in every industry, what to talk about healthcare industry only. So therefore, it is eminent and it's very timely that we have a basic concept and idea and sensitize ourselves with the supply chain management in healthcare system. It's a very complex kind of a thing as on date because of various factors. As we go ahead with our discussion today, we will come to realize that how complex it can get. It is not like buying some product from Amazon or something which is a non-medical item. It is an actually a consumer-driven system regulated by various hospitals and other bodies. Therefore, there are multiple stakeholders, and it is imperative that we understand the system. For today's purpose, to have a basic understanding, I have listed the discussion chain in the following heads, as is available to you, as you can see that. Now, having said that, the healthcare supply chain configuration revolves around producers, that is the manufacturers, that is the persons who are actually getting the raw staff material, active ingredients, composing into various production lines, and therefore they are making them. They may be retailers, wholesalers, forfeiters, and so on. And from there it comes to the purchasers.
Ankit, please mute
And
yourself.
the purchasers if I can request the mics be muted.
Actually, please, all the students to please mute their mic. All the students to please mute their mics because it's causing disturbance to the speaker. Thank you.
Thank you so
Yes,
much.
Kalpanaji, please.
Thank you. Now, where I was, yes, the producers are those people who actually are providing the medicines to the purchasers. Now, the purchasers here may be in the form of group purchasing organizations, which is not really existing in India at this point in time. We have wholesalers, we have distributors, and then it ultimately goes to the healthcare providers. Now, in this format, we need to see that how a healthcare provider who is getting the input or a consumer order supplies it with the minimum lead time, and therefore the essence of availability of medicine, quality medicine at the tick of time when it is needed is always there without maintaining a huge inventory and therefore incurring a huge inventory carrying cost. Now, this is not as simple as it gets. It's a very simplistic way that has been reflected in the viewfoil. There are insurance companies who are the drivers. Actually, they not only direct, but they decide what type of medicines a consumer can buy. The government, in terms of levying tax, property tax, other taxes, and also taxes on the suppliers and wholesalers and the manufacturers. And other regulatory agencies also play very important role in deciding the availability of medicine, organization of a company, and so on. Now, what actually triggers a supply chain? Supply chain is basically cycle-based, which will come subsequently. But the problem here is that once a medicine demand is there and medicine demand is scheduled with a wholesaler or retailer or with the manufacturer, they need to arrange for the active ingredient. Now, this active ingredient has to be in a purest form as it's for the medicinal purpose and consumption of the human being. So therefore, it takes time for the manufacturers to produce those medicines. Leave aside COVID vaccinations, even a medicine takes years, 5 to 8 years for production. Anyways, notwithstanding that, once it is produced, then it is converted into a consumable or usable form. And many production lines are open through that. This results in multiple outlets and multiple countries where the medicines are produced by the manufacturer, depending on what type of taxation laws, what type of regulations they have, what type of drug laws that country is having. Wherever a manufacturer, ultimately it is a money-driven system. So wherever a manufacturer gets a cheaper production cost, he goes into that particular country. Therefore, even if a demand is generated, at times it is not met within the required time. Therefore, it is essential to have a streamlined flow and have few particular systems in place, like virtual conglomerate, virtual aggregation of the medicine demands system and control system. Also supply management softwares and supply management teams who are doing the same. Even to the extent that if the inventory can be managed by vendors, if they are on rate contracts. So therefore, they would be responsible for supplying you something called just-in-time medicines, which is still a very new concept in India, but coming in a big way. So this reduces your bulk of your inventory and therefore eases the inventory maintaining cost. This particular cost can therefore be apportioned for patient care benefits and other purposes. So, as we understand that right to health care is an emanation from the fundamental right enshrined in Article 21 of the Constitution of India. Everyone has a right to have medication, treatment, and at times if they are destitute or below poverty lines, medicine free of cost at the cost of the state. So therefore, affordability and cost control is the main imperative so far as supply chain management in healthcare is concerned. Now, how do we do that? When there is a requirement of medicine, we have to understand few basic concepts of medicine production. Medicine production, though they operate on a high-end, high-cost medicine and equipments, the actual operation cost is very low, especially with the wholesalers and retailers. So, and this is more because big hospitals and groups, also there are certain lobbying and other agencies which control a particular rate of that. But whenever the market becomes bigger, the supply becomes wider, obviously the cost would come down and affordability would be less, would be more. Now the cost control also helps if we can reduce the inventory carrying costs. So therefore, we would be having a better position with same sort of funding to deal with the matters in a better way and in a more controlled way. Now, efficient flow of information and transparency is extremely important. Now, within the system, we have lead time. Lead time meaning thereby is when the patient demand is raised, and finally when the drug or the particular equipment is supplied and is effective to the patient. That is the lead time. Now, the question is that the lead time can be external and can be internal. Now, if there is a medical information system, a robust hospital information system is in place that shows the flow of information rapidly, and therefore the required inventory or required medicines, consumables, otherwise other items can be generated in time and can be there available for the patient in time. Of course, if we have an organization, a central working organization based on purchases as a direct demanding office or otherwise, the quality and accessibility, the specifications can be regulated. And other customer service initiatives like service availability, response time, and asset utilization would automatically fall in place and would be beneficial to the hospital care providers financially and also would earn goodwill. Now, what is the basic difference of traditional planning approach? Traditional planning approach are generation of the requirement in the form of medicine, consumable, non-medical essential items, linens and other things. And that is then procured item-wise, and accordingly demands are raised, maybe periodically or otherwise. Once a purchase order is generated, depending on what type of system a particular organization is following, the government has an elaborate system in the form of GFR, that is Government Financial Regulations, as well as Defense Procurement Manual and other items. So that takes a longer time depending on the financial powers vested with the particular competent financial authority. So therefore, if items are costing more than that, further sanction of higher authority as required. This takes time. Forecasting of medical equipments or medicines a very difficult situation, because you would not know, though some amount of forecasting can be done based on the consumption pattern and the requirement of a drug in a hospital, but it has to be understood that the more expensive a drug, more yearly consumption cost of a drug should have least amount of drugs, such drugs available in the inventory. They may be procured more frequently, not to block money or capital in purchasing them. Whereas items which are lower annual consumption should be more in the bulk and purchased and kept in the inventory. Coming back to the point is that when a procurement material is required, it's to be generated, and accordingly the vendors are notified. Then they in turn inform the bigger retailers or wholesalers, and from the manufacturers the items come. There are stumbling blocks, if I may, or there are obstacles in every phase of buying the same. Manufacturer would, depending on his capacity, his geographical location, availability, or some other issues, would accordingly be able to provide, or this would take more time. And therefore, thereafter, once manufacturers are ready with their supply, the sale process begins. Whereas in supply chain management, it is absolutely real time, as information, funds, and material would interplay between the supplier and the customers directly, maybe through the providers. So therefore, time taken is less. Information being the backbone, it is very easy to predict through various analytics that we will discuss later, that how a medicine requirement can be forecasted, barring few emergency situations. However, one has to remember one thing, that supply chain management actually works very well for chronic ailments, chronic patients, and patients having chronic requirements. For acute cases, so far, supply chain management has not been proven to be that. And now, there are various cycle views, as we understand. There are customer order cycle, that is the demand generated from the customer. There is a replenishment cycle, when the retailer replenishes. There is a manufacturing cycle, when the manufacturer comes into play. And finally is the procurement cycle, when supplier get the raw material and other resources from outside. However, these are interlinked, and actually these orders are interfaced to each other. Between customer, and retailer, there is a customer order cycle, and so on. Therefore, we must understand that if the customer order cycle, there's a demand generated from the customer, say a particular item Dell wants to buy, Dell buys from a retailer. Dell is a retailer, he buys it from the manufacturer, depending on what are the requirement of the customers. And so, say Walmart buying something from one of their manufacturers as per the larger sale, larger consumption by the customers. So this is a customer-driven service or requirement. This is the pull method. Whereas it would be important that it is understood that in a pull method, there will be some lag time. Whereas if we can anticipate the requirement and thereby place our orders well in advance within a particular time frame, that is the push view, which would be very, very relevant in providing the medicine and other consumables in a real time when appropriately required. So therefore, The benefits of supply chain are many. Firstly, it gives you a competitive advantage. It generates a lot of goodwill. It reduces the inventory carrying cost, as I have repeatedly stated. Also, it prevents a stock out situation. And also, you may not be required, if it is done correctly, to spend more time and money and energy in asking for emergent indents, making emergent indents. Accordingly, the customer satisfaction would be highest if an appropriate supply chain management is practiced and effective. Since there would be less manpower involved, the efficiency would definitely go up. There will be less requirement of hospital staff engaged in maintaining the inventory. They can be used otherwise. Cost cutting and minimizing inventory investments is very clear. Depending on what you require, you can have a proper specification. So quality material can be ensured. And of course, it would help depending on the customer specification. It would help in product design and supplies accordingly. Now, the factors for supply chain are as listed here. What would be the supply chain structure? The supply chain structure actually depends on what type of setup that you are having. Supply chain structure would be very, very important in deciding that what you want to have and how do you want to treat a particular case or a group of cases. Say you want to know that what are the medicines that is given for say HPV related throat cancer. So accordingly, your structure would be defined by the requirement. Also, say you have developed an app for the Alzheimer patients. What all conditions and how Alzheimer patients develop and their disease progression, if it's in the app, which is in a question answer form, then lot of fatigability of the hospital staff and paramedics in explaining these situations would be reduced. So therefore, accordingly, you can structure the same. Also, say if you can chalk out through various artificial intelligence and machine learning procedures that how a person, what are the risk factors, say, of COVID-19 infection. So it is through those means that you can channelize and structure your supply chain. Of course, this will determine your inventory control policy and the basic understanding of the VED, ABC analysis, first in, first out, and others, they do remain in place. However, it will be important that you can have just-in-time medicine inventory control and can effectively reduce the bulk of your inventory. The information sharing, on what platform you would have the information sharing, it would be very, very important that the pharmacy has a direct information sharing system with the prescribing doctors. So therefore, the gap or information lacking is less. Also, there are various ways in which the supplies can be tagging for their real-time movement within the hospital and without the hospital. So that can be accordingly planned. Customer demand, how you take these demands, how you differentiate and distribute various customer needs, whether they are inpatient demands, outpatient demands, that can be accordingly chalked out. And based on that, a forecasting method can be formulated. After all this, you would come to know that how the lead time is getting affected, and then over a period of time, you can review the same. These are the factors that will deal with the supply chain, whereas the functional areas that would be affected by these factors are supply planning. The increasing use of artificial intelligence with machine learning techniques will entail you or will tell you how to plan for a particular procurement process or medicine, what would be required in future, what the future is holding for you. would be told by them. Of course, accordingly, production planning and inventory planning can be made. What type of manufacturers, what are their capacity to handle, who would be the retailer, whether they are OEMs, all would depend. And accordingly, you can frame your functional area. This would determine your capacity planning. Distribution, of course, is an internal process, which can be easily handled. There's not much of a problem in that, as that is within the control of the hospital itself. Now, what are the steps in designing supply chain in a hospital? This is a core area of our interest. Firstly, it is very important to define goals. Goal defining actually is, if you've done properly, half battle is won. Here, you need to see what are the types of patients that you are targeting. What are their aspirations? What are their expectations? What are their demands? What do they need? From what demographic area they belong to? What type of socioeconomic status they are on? What are the affordability, lifestyle diseases that the particular area people suffer? What is the lifestyle? Would easily chalk out a group of people according to their need. The need may be an intensive care, immediate care. Need may be closed care, very close care. Need may be periodic care. Need may be scheduled care. Need may be as and when need occurs. So therefore, you have segregated your patient load into another patient that they are coming to you, they are approaching you into various grades. Depending on the grades, a demand planning can be done based on whether they are actually require a primary care, which is an individual doctor driven, clinic driven. It can be a particular mobile clinic system as well. Or do they need secondary care, where the basic specialty care would be required? Or do they need a tertiary care of high level complex investigation and treatment facilities? Or is it that they just need a preventive clinic? It is just that that they need a basic cursory medicines and help and reassurance rather than active practicing. Those would be very, very important. So if you can segregate your clientele into these lines, you would find and would be able to define your goals so far as procurement of medicines and consumables and non-consumables in the hospital in an appropriate way. Gathering support data you can have from manufacturing process. You see the compliance accordingly with the inventory control policies that is within the inherent to a hospital, what they want to follow. The logistics supports and what type of cost that a hospital authority is ready to shed for this process would be very, very important. Now, predictive analytics is very important in this, that it would tell you that by seeing the patient data, the treatment modality, what type of drug they have been given to treat, would give you a real-time state that what type of medicines are being spent, what is the outcome of a patient with a particular given modality of treatment, and what type of investigation is giving you a more better insight in a particular diagnosing a particular disease process. So therefore, this is very, very important in determining the notion or the mode of your supply chain, which way you want to do that. Because if you can feed it into a particular machine learning process, they would generate workable solutions and data, which will be very, very useful for you in your future course of action. Now, it is very important to see that on what location you are required to deliver. It may be a far-flung place, or it may be at the heart of the city. Depending on the location and time taken, lead and lag time that so far we discussed, you can have a stocking point and stocking methodology worked out. What would be your sourcing? How will you stock? How long do you stock? When do you generate? Is your lead time should be 5 days? or it would be less than that. All would be dependent on your location decision. Now, production decision would be very, very important in the eventuality of operational decision of the hospital. If a hospital is generally treating a chronic ailments patient, say cancer hospital, their operational requirement would be different from a hospital which is primarily dealing with emergency care. So for emergency care, impact decision making would be very, very relevant and important. So you can have a database in which you can find out what type of medicines, what type of consumables, what type of other essential items, the linen and other things that you are actually spending on a day-to-day basis, and what would be their turnover rate. So accordingly, you can plan the production decision. So far as asset tracking is concerned, nowadays people are going more for electronic means of tracking rather than on-site barcode. There are various modalities of your asset tracking, en route tracking. So therefore, real time would be known to you when this product should be made available to you. Efficient stock management, of course, should be laid or left to a particular group of people efficient in doing this process. As we have spoken about the use of analytics and real-time tracking, this is self-explanatory and does not need a further discussion at this stage. It would be very, very important to state that all these are by themselves a topic of discussion. So I am just today touching on these issues so that we are kind of sensitized with these issues so that we can deal with them while processing the while going ahead with the course that is intended by the organization. Now, how do you evaluate your process of supply chain? How do you know that the supply chain is whether it is giving you the desired result, whether it is bearing the fruit or not? So therefore, KPI is very, very important. The KPI for supply chain can be determined by cash to cash time. What does it mean? Everything, as we understand, and you will agree, that is on money. Money matters. So therefore, cash to cash time depends on when you have actually spent on your inventory and what the return you are getting. Lesser the time, definitely better is your system. So to determine cash to cash time, one would say the day of order, a day of payables against the overdues that you may need to return. So if you add a day of order and day of payables and subtract it from the overdues, you will get cash to cash time. Lesser the time, better it is. The biggest example is Apple. In fact, actually, Apple has gone into a negative cash to cash time, thereby stating that they are earning while they had even not started spending the money. So therefore, it is very, very important. And what is perfect order rate? What is perfect order rate? Perfect order rate is that when an order is generated by the customer order generated, and within the particular specific time, without any hindrance, on the expected date, the medicine was available to the customer. And that is a perfect order rate. This is one of the factors that would determine the case. Now, fill rate is individual, that when a demand is made, whether you need to make further demands or a primary demand has been good enough to fill up the requirement. That is what is fill rate, and KPI, this is one of the factors in the KPI to determine that how good is your system that you have placed in, that you have made, placed it with you for your process. Now, customer order cycle time, we have already spoken. Inventory days of supply is also a very important factor. Inventory days supply is actually, again, it is the money, is that the amount that you have gained overspent of your inventory divided by the number of days that particular inventory is held for a particular period of time. So the bigger the numerator, lower the denominator, that is, if your money is a bigger amount that you have spent more than inventory more, with a lesser amount of time that is kept in the inventory, would determine how good you are. The bigger the number, better it is. Now the question is, we have spoken so many times this word inventory. Actually, what is the inventory means? What is inventory? Inventory, to my understanding, is an asset that is lying idle, provided this idle lying asset has a financial bearing. Therefore, even in an aircraft, the empty seats that they're going is an inventory. So that is the very basis of understanding the supply chain. Of course, inventory turnover, you understand it all. I need not to explain. The on-time shipment and delivery. What is the time taken when you have placed an order? Within what time the order has been materialized? When they have been scheduled for dispatch? At what time you got it? Was the order returned? Was there is a variation in pricing? Whether it was overpriced, over specified, under specified? What is the reason? And supply chain cost obviously matters. With all these, would create an effective dashboard for KPI monitoring. The KPI stands for key performance indicator. I hope we all are on the same page. Okay, now what are the strategies to improve the supply chain? Obviously, we should have a robust contract management. Please understand, contract is a legal issue, and therefore it cannot be deviated. So please be very, very sure what are the terms and conditions that you put in a contract. The contract cannot be one-sided. There has to be some points in which how the payment would be made, when you are expecting the delivery, in case the failure of the delivery, what are the safeguards that you have as an organization. At the same time, there are components like force majeure and other things also be incorporated, so that a vendor or a dealer is not unnecessarily prejudiced. Also, it is very, very important to have an arbitration clause in the contract management, so that you don't have to rush to legalities, which is time consuming and money consuming. Also see how you can have a list of vendors for particular medicine, which are high quality, as well as you need that appropriate salt or active ingredient, so that you don't land up buying a substandard medicine. You need to develop an effective inventory management. Please understand, inventory cost is telling on the health sector. The reason for this is primarily there is a long shelf life or long production time for medicines. Medicines are not produced off the cuff. It takes time for production of medicine. Also, the operative cost is not very high. It's a very small range that the vendors and the wholesalers, retailers, they deal. Also, that we don't have robust supply chain management education, that leads to the problem. So you need to have an effective inventory management as to see for which part of the inventory you can do away with, and have a supply chain that is robust enough, that is effective enough, and that is sure enough that would be delivering in time, so that your inventory takes less space. It is very important for us to understand that we need to create less inventory to give more space for patient care in terms of physical space as well as in the money. That is very, very important. At the same time, we must not get into a situation where the drugs are getting obsolete. There is non-delivery resulting in loss of goodwill. You have to make emergency purchases, more loss of revenue. So these all factors need to be seen in developing an effective inventory management. Accordingly, use of technologies and analytics are there. Effective pricing system, if it's a competitive world, if you have a broader vendor base, broader manufacturers, the price bound to come down. Also see effectively what are the alternate means and medicines that you can have for a particular treatment of a particular ailment. So all these will help you towards improving your supply chain. So therefore, as I stated, the product life cycle is a point of contention, as it takes 7-8 years for an active ingredient, active pharma ingredient or API to develop. Once that is developed, the profit margins are low. However, when this API is converted into consumable form, the process gets speeded up, as there are a lot of supply production lines can be opened. Forecasting has been an issue, as I have spoken earlier. Education on supply chain would be very, very important, which is the core issue of today, and would be subsequently and would be dealt by the organization, as the director has very correctly brought up. Now, supply chain integration is very, very important. We got to have, at this point in time, a centralized controlling system for supply for various providers. We need to get out of this, I should be better, I should be overdoing others. And as a result, I would win better clientele base must be for them. Product availability and their minimizing storage space would be very, very important. And the future holds in this only. This is only possible if you have a group of people who are virtually contracting and communicating with each other, and thereby making a plan or policy. Even to such an extent, vendor-based control would be a welcome measure. Also, minimizing non-liquid assets would be of the need. Material handling and costs of medical staff employed in inventory control should also reduce. Therefore, the overall overheads, the cost that a hospital incurs, would also go down. So therefore, the strategies are having a virtual centralization of supply chain. In this, the organization needs to come together, and they are supposed to make a policy, what type of medicines are required, what are the time frame within which medical equipments, medicines, and all these items should be required to be procured and given to the clientele. That needs to be worked out. Then there are various applications in healthcare. More and more, the radio frequency identification is coming into play over and above the barcoding that we've got. This obviates the in-site inspection and a manual intervention in healthcare, and therefore speeds up the process. The problem with RFID is that although the tagging is done to various supplies, the placement of tagging, the movement of this may interfere in real-time tracking, and also within the hospital, their movements, and at times in a particular ward, having a RFID tagged patient or an equipment may be a hazard. So these needs to be just seen within the hospital system, and plan or other process and SOPs can be made accordingly. The supply utilization management is very, very essential. Once supply is asked for, what type of supply that we are having, either they overspecified, that is not required in the hospital setup per se, but we have got it, or they are underspecified, we are having not unstandard or below standard medicines. Is there a value mismatch? Value mismatch is in terms of whether a particular medicine or particular product gives a desired result or not. That is very, very important. And also vendor managed inventory is what would be probably stored for us in future. And that I conclude the presentation that supply chain management, collaboration, outsourcing, of products, It would align our standards, as many countries are way ahead of us in this. And probably it is not very far that we will have a robust supply chain in every phase, every sector, from primary care to the tertiary care of healthcare in India. With this, I come to an end of the topic. I shall be there to answer, should there be any question.
Thank you. Thank you very much. Thank you very much, Colonel Ashish. A great, wonderful session by you. And we have the audience. I would request the audience whether they can have, if they have any questions, you are most welcome to please ask. My video is also on. We have good number of students, around 30 of them.
So,
Can we have you please? Any questions from your side? Kal Banerjee will be very happy to answer that. You must be really keeping busy with the courts, because your profile is also loaded actually. I think
yes, sir.
Along with supply chain, you have a lot of responsibilities with the legal cases of the
Yes,
ministry, isn't
I
it?
have live sessions with hospital owners and doctors. I
Oh,
try to
really?
lead them in medical negligence issues, which are, I think, raging in India, unfortunately.
Very interesting. We have very few people, those who are, besides being doctors, are also into legal profession, and they make a good person actually, because you understand the medicine, you understand the hospital healthcare, and then also the law. So it's a edge over the normal lawyers and advocates actually.
So, thank you so much for your kind words.
Yes. So that's great. And yes, students, any more question? We'll request Kal Banerjee to also be with us for certain other activities, including the legal aspects of the hospital and healthcare. Yes.
Would be grateful, sir.
Thank you. So, Polomi, are you there? Dr. Niru is there? Hello, Polomi. Polomi? Yeah, maybe she will be. Any questions by any one of you?
Sir, I think there would be no question now. We can end this session, sir. I think I have taken more time. I didn't realize.
No. Actually, when you are talking, so we started 10 minutes late also.
Yes, sir,
I
I'm
think-
there, sir.
Yes, follow me. So,
Yes. Yes, sir.
Kal Banerjee has completed. I've invited questions, but it seems they have hardly any question. There are only two things, that
Right.
either you have followed everything or you have followed nothing. But in this case, nothing is not applicable. Everybody has followed everything. So, because it was such a lucid presentation. So,
Right.
with this, yes, is Dr. Niru
Sir,
available? Or
ma'am is busy.
Okay.
Yeah.
So, Polomi, thank you for arranging everything, and we request Kal Banerjee to be, we'll request him again for various activities of Astron. So, with this, let me once again thank you and thank all the audience, and thanks Astron for all this. So, now we can have a good evening to all of you, and bye-bye.
Bye, bye, sir. Thank you, sir. Thank you so
Thank
much.
you.
Thank you. Thank you.
Thank you.
Thank you, sir.
Yes.
Thank you, Polami ma'am. Bye.
Thank you.
Thank you. Bye. Bye-bye.